people and we respect their spiritual relationship with country. So what we're hoping to cover today is give you an opportunity to have a perspective on injury prevention, injury management within organisations and have a systemic overview over it. In one of the recent presentations that SafeWork Library put on, it was on resilience. And this follows on in a bit of a continuum that we want to talk to you today, and I will be focusing on early intervention by looking at mental health first aid, and Eleni will be looking at recovery in practice, which hopefully will give you a lovely seamless overview of how your system should be working. And we're going to focus in the context of mental health and mental illness. We've only got half an hour, so we hope to give you a really good overview, and we will be available after the presentation to answer any more questions or talk to you individually if you've got any questions. So we're from an organisation, nb&a group, down at Richmond, and one of the programs that we run down there is Mental Health First Aid. I've been running the program since 2004, and it's an early intervention around first aid. Now, most people in workplaces, particularly key people, and where legislation requires, have done a regular first aid course. And what we know about regular first aid, it doesn't cover the areas of mental health, particularly what would you do if someone was having a panic attack, what would you do if someone was expressing plans around suicide. So this is what the mental first aid course looks like. It fills in the gaps where regular first aid doesn't. However, they both have the same aims. The aims of the first aid courses are to preserve life, and in the context of mental health first aid, that could be to give you the skills around what would you do if someone was suicidal or having a panic attack or a traumatic experience. To stop the problem from becoming, from deteriorating, to promote recovery with realistic optimism, and sometimes it's simple but very important thing of giving someone some comfort and reassurance. So the aims of mental health first aid are the same as regular first aid, and it teaches you things you don't cover in regular first aid. So mental health first aid came out of Canberra in the year 2000, and the program we run is that program, and it's now an international program. It's the international benchmark for mental health first aid around the world, and you will note, we do note that even President Obama has endorsed it in America. So it's gone worldwide, it's international. But mental health first aid is offered to a person who may be experiencing early signs or developing a mental health problem, even being emotionally challenged, not necessarily having an illness. But the mental health first aid framework gives you the skills from very low emotional challenges right through to someone may be in a mental health crisis. Okay? And the mental health first aid skills are applied and the strategies until appropriate treatment and support is received or until the crisis is resolved. Now, the mental health first aid, we must stress, it is not training as a self-help program. It does not teach people the skills to make a diagnosis or to replace the health professional, and rather it supports or enhances and complements these programs. And as an early intervention strategy, it actually complements the EAP program. In fact, it probably precedes it, because people with the skills in mental health first aid are often the people who recognise and encourage people to access EAP services. And you're a very informed group of people, so all of you are aware of the benefits of early intervention. So why do we need mental health first aid? Well, I've already mentioned that the regular first aid course doesn't cover the content that we cover in mental health first aid. But we do know in our community, 1 in 5 people in any 1 year in Australia will experience a mental illness or a mental disorder. And that's quite a lot of people. That's 20% of people in 1 year, and we know this from Australian data. We also know that in Australia and internationally, as a community, we have very poor mental health literacy. We're not well informed or understand mental illnesses, and we don't often know what helps people with a mental illness or developing it. We also know there is stigma, and these are all barriers to people getting help. And the stigma can be the self-stigma, the stigma, the shame and the guilt the person with the illness may be experiencing, but also the stigma that they experience from community. So mental health first aid is an education and awareness program that supports your risk management within the workplace. We also know that unlike physical health problems, a person with a mental illness may not know they're not well, and that in itself can be a barrier to return to work. And sometimes it's an issue of accessing services, regional remote areas, or barriers related to finance or culture. So there's a whole range of reasons why people, we may see people experiencing barriers to accessing help. And all the more reason why we need people skilled in the workplace and in the community to be able to recognise when someone may be becoming unwell or is in a crisis, and how to respond in a way that's actively constructive to enable recovery and early access to services. So in the course is actually, the complete course is over 2 days. It's very portable and flexible in its delivery. And in the course, as I said, we cover evidence-based material. Over the 2 days, the complete course, we actually look at some of the data that gives us an idea of how prevalent mental health problems are in Australia. And we introduce people to the Mental Health First Aid Action Plan, which I'll introduce to you today also. The action plan is really your tool that will guide you, just like DRABC does in regular first aid. We cover the most common mental illnesses in Australia, and these are in no particular order, but we look at depression, the different types of depression, the different types of anxiety disorders. We look at psychosis, bipolar, schizophrenia, and we look at substance use problems in Australia. These are the most common mental illnesses in our community. And we also cover some crisis situations. We show DVDs, we do some case studies, we have open conversations, and we have a shared learning experience as well. In the 2-day course, we cover the topics of suicide, panic, trauma, how to deal with someone who may be experiencing an acute psychotic state, aggressive behaviours. And the good thing about the framework is the learnings that people achieve and the outcomes, the information they have, are very transferable into lots of other areas, because you're actually developing your existing skills around engaging and communicating with other people to, as I keep saying, get early intervention and promote recovery. In the course, as I said, all the material we provide is evidence-based. You're given practical skills, and we give people guidelines. They're evidence-based guidelines to inform you of how you do your intervention. And it promotes early recognition intervention. The course itself has been evaluated, and some of the findings of the researching the participants' experiences, that they do report reduced stigma, less social distance with someone with a mental illness, and improved confidence in how to approach someone with a mental illness. Because we do know from talking to employers and businesses and the community, a lot of people just don't know what to say or do. So this is one of the advantages of this course. It fills the gaps, and for some people it actually reinforces and supports what they're already doing. So it's very comforting and reassuring for participants. And in an organisation, it does promote a culture of help seeking. So people do put their hand up and know that they won't be discriminated or judged. And it does create a culture and promote a culture of well-being. It is an active communication and intervention skills training program with a focus on the conversations we have and the action we take, because it could change a life or it could save a life. The Mental Health First Aid Action Plan that guides you, we refer to as Algae. You'll note these are actions, not steps. So in the course, we use this framework to give people the skills of how to apply Algae to helping someone with a mental illness or in a crisis situation. We have a little mascot which we call Algae. This is an Australian framework, and we say it's international. And the reason we use Australian flora and fauna in the presentation training is to enforce or remind people that a resilience is required. Resilience is required for the person with the illness, but also the people supporting them. And from what you know from previous presentations, resilience requires you to adapt and learn new ways to cope. Now, Eleni will be talking to you in a little while about recovery and some of the elements of recovery and creating new purpose and meaning in your life. So this is a systemic approach or systematic approach to how you manage the risks and the management of mental illness or health problems in your workplace. So let's have a very quick look at Algae, and I hope it whets your appetite to find out more. But action 1 is your risk assessment action, and we teach people the skills on how, when, where, how do you approach, assess and assist someone as your first priority, particularly if they're looking for a crisis. Okay? And the crisis, as I said, that we look at are suicide, panic attacks, overdose. When you're helping someone, the person you're helping wants to know that they're being listened to. And the important thing about action 2 in this framework is listening non-judgmentally, because you certainly don't want to create more social distance or barriers between yourself and the person. And listening non-judgmentally is done right through Algae. Okay, and it's listening using your verbal and non-verbal skills to engage and connect with the person before you can assist them. We know empathy is a very important skill and a trait to have in this context, and we know the power of empathy in connecting people. Action 3, give support and information. Now you move into assisting the person. And you assist the person, supporting them with emotional and practical skills and giving them information and the type of information that helps them. Because there's a lot of information out there, and this is really important because it dovetails beautifully into recovery, wanting to empower them and to be active participants in their own recovery and well-being. Action 4 and 5 begin with the word encourage. It's about enabling the person to take the step of something that can be very confronting and fearful towards their own recovery and accessing help. And we look at what is the appropriate professional help, and we give participants an understanding of the different types of help that's available to people with a mental illness. And Eleni is an occupational therapist in mental health, and this is one of the services that is appropriate for someone with a mental illness. Sometimes it can be just helping someone access financial support, and that's the appropriate professional help that's required. So one of the biggest challenges to someone with a mental illness is accepting that they have this illness, or accepting that they have a need to see a professional. And this is where the mental health first aider supports them by encouraging them, enabling them to do something that is very confronting and frightening. And action 5 is the other supports, and this is where the workplace plays a critical role. And we know a lot of research that sits behind the role of the workplace in supporting recovery and the role of the supervisor. But we also stress that first aiders have to look after themselves. And the more information you have as a helper also means that you protect yourself and manage the risks associated with the role that you have in helping others and when you're a caretaker in the workplace. But resilience, early intervention on their own don't create purposeful and meaningful lives. We need to have an understanding of what's required in recovery. Because remember, action 3 gives support and information. We're giving information and support by giving people hope of recovery, that things will be better. So what does recovery look like? And even though it's a term we use quite loosely, like we do support, what does it actually look like? And there's a lot of research and a lot of frameworks around recovery. In the context of mental health, the recovery framework that's very important, but similarly in physical recovery, is a psychosocial model. It's about developing meaningful social roles, relationships, vocational activity, to understand the experiences that the person is having. And the cornerstones of psychosocial recovery include elements of hope, personal responsibility, hope of recovery, personal responsibility, because people feel helpless and hopeless. They need support from people around them. They need psychosocial education and information about their experience, purpose and meaning, and self-advocacy. We don't have time today to go through all of them, but Eleni's going to spend the next part of the presentation to take you through a journey of what recovery looks like from the perspective of occupational therapy. So I'd like to introduce you to my colleague, Eleni.
Thanks, Doula. Thanks, Doula.
Thank you.
So yes, my name's Eleni. I'm an occupational therapist, and I'm working in a recovery-oriented mental health occupational therapy program which delivers services to people with psychological injuries in the workplace outside the workplace in the income protection field. So today I just want to cover what Doula started talking about, which is recovery. And it's important to note that recovery is more than just cure, and more than just treating the symptoms. So, and it's a very personal and unique process. There are many perceptions and definitions of recovery. This is just one, and it's about helping facilitate changing attitudes, values, feelings, goals, skills and roles to live a satisfying and meaningful life and contributing to the community. And it involves the development of new meaning and purpose in one's life as one grows beyond the catastrophic events of mental illness. So I'm just touching on, there are many common factors, even though recovery is a very personal and unique process. The common factors are things like hope, so these are the cornerstones that Doula mentioned earlier, and even the smallest belief can fuel hope. So hope is a desire accompanied by a confident expectation, and it's the foundation for ongoing recovery. And you only have to think about what it's like not to have hope, to have that sense of hopelessness, that you really understand how critical hope is in moving forward. Another factor is medication and treatment, and this might be a process of finding the right medication, of finding the right treatment service provider, the right program. But feedback from people in the mental health arena obviously talks about the value of finding the right mental health professional or treatment programs and how critical it is to be engaged in those. Self-advocacy and self-responsibility, it's really important to have a sense of control over what's happening and the direction forward. And as Doula mentioned, being an active participant in your recovery and not a passive recipient. So people tend to value things that they contribute to more so than having things just happen to them. So it's a critical factor in recovery. As is support. So and support can look like come from multiple sources. It can come from family, friends, peers, and in the workplace, there's lots of research to support the benefits of support from supervisors and colleagues on outcomes of recovery. And support is critical in reducing a sense of isolation, which can further compound mental health issues, which one of the signs or symptoms of say depression is that social withdrawal. So we want to be able to tackle that the best way we can. And support increases activity by people actually actively reaching out for support. Recovery is also about educating yourself with as much information as possible about what's actually happening, what the illness is, what the condition is, what the medications or best treatment practices are, what are the symptoms, and what are the early warning signs for you as an individual. And that can be really helpful in a work context where if you have the support of a colleague or a supervisor, that can be stated and anticipated with a recovery plan in place. And the final factor is around employment and meaningful activity. And we all know that working can be good for your health and recovery, and it gives us a sense of positive identity and a sense of purpose and value. But the other part of this is engagement in meaningful activity. What we try and do is work out what matters, what is of value, what are people willing to put up with or tolerate in order to do what matters to lead a rich and meaningful life. And that's where my role as an occupational therapist comes in. And I'll just give you a little bit of background about occupational therapy if you're not aware of the profession. It's concerned with promoting health and well-being through occupation. And occupation isn't just work, it's the things that we occupy ourselves with every day, or the meaningful activities that we do. And the primary goal is to identify the person's strengths and barriers to functioning. It's about restoring functioning, to enable people to participate in those occupations that are meaningful and important to them. We look at the person, the environment and the occupation, but specifically looking at the overlap or the interface of that on the impact on the person's occupation. What happens if you don't have occupation? There could be a temporary disruption if you break an arm or a leg where you have to make temporary adaptations, or it might be occupational deprivation where there's a real lack of engagement in meaningful or desired activity, and that might come from a penal system where someone's incarcerated, or it might be through a serious condition, whether it's a physical or mental health condition where a person is no longer able to engage in things that were once meaningful to them. So how this works in practice, mental health occupational therapy has a philosophy that in order to have a successful return to work, we need to look at a person's functioning outside of work and strive for a balance between work, leisure, rest and relaxation. So some of the people that we work with can't even get out of bed or shower, let alone get themselves to work. So we're looking at basically paring it right back to activities of daily living for that person. It's designed specifically to increase function, productivity and capacity, and it's an in-home program. So if someone's really struggling to get to work, it's much easier to see them in their home environment or a community context to enable them to actually contribute towards steps of recovery. And what we need to do is look at some goal setting and prescription of graded small bite-sized chunks of moving forward goals and tasks, and set up an immediate work hardening program using the things that the person can do at the present time, whether that's home activities or whether that's work-related activities. To do this, like I mentioned earlier, what we need to do is establish what's important. So looking at what a person can do and how important those things are to them, to identify a list of priorities and then to make some goals around what is really important and what matters and what are we willing to tolerate in order to do what matters. Important part of the rehabilitation program and really demonstrates commitment. And the way that we go about implementing these goals is basically to use activity scheduling, looking at behavioural activation techniques to schedule things based on activities rather than mood. So if we wait for people to feel better or feel like they previously did or feel like the old them, then we might be waiting a long time. So the idea is just to do it, just to get up there and do it, do things based on schedule, not mood. Looking at programming, task, routine. Many people find that with illness or mental illness, they lose that sense of daily routine. So it's about like re-establishing a routine and looking at skills training and psychoeducation, which might be really important in that self-advocacy and self-responsibility cornerstone of recovery. So helping people not only understand what's important about their illness, but also things like self-esteem, assertive communication, anxiety, stress and sleep management, which all impact on a person's health and well-being. I just went through that in 5 minutes.
So I think we're just on one. So are there any questions around the programs? Pretty straightforward? Okay.
It looks quite interesting, actually.
Yeah. Well, so we've been running these for years and the demand is quite high.
Yeah.
And we will go into regional areas as well, remote. So we're getting very good feedback and the program's growing. And we're seeing more and more of these programs being embedded into workplace systems, particularly now with the big emphasis on introducing into our conversation, our dialogue, more the word recovery rather than rehabilitation. We feel it's very important that people understand what recovery is, because quite often we're not dealing primarily or only with medical issues or medical barriers, but they're often the barriers to recovery or return to work are psychosocial. So it's giving people the opportunity and knowing what services and interventions do help. And at the end of the day, what you want is a good outcome for that individual and everyone to feel like it's a life worth living. So thank you very much for your time and listening to us. We're hanging around a bit longer if you'd like to talk a bit more. We've got our cards as well. So thank you very much for your lunchtime.